My name is Zach Carver. I'm going to be the pharmacist in this scenario. Christina's going to be my patient. Right now, I am just going to be putting in my basic information. We are on case 4, the yellow. Okay, I'm ready when you are.
Yeah, let's go for it.
All right. Good afternoon and welcome. My name is Zach Carver. I'm a student pharmacist here at High Point. How are you today?
Good.
Excellent, good. Well, welcome. Today I'm going to be taking your med history, just
Okay.
getting to know you a little bit and everything that you've got so we can have that data here for our pharmacy.
Okay.
Okay. But before we begin, can I just get some verification on who you are and when
Yeah.
your date of birth is?
Yeah, so my name is Sarah Johnson and my date of birth is August the 2nd, 1952.
Excellent. Thank you so much for clarifying that for
No
me.
problem.
So the way that we're going to do this is I'm going to be asking you a series of questions starting with the current medications that you're on.
Okay.
This will include your current prescription-based medications and any over-the-counter medications that you might be on.
Okay.
Next up, I'm going to ask you about any medications that you may have stopped in the past.
Okay.
Then I'd like to talk a little bit about any allergies that you may have.
Okay.
And finally, I just need a little bit of information about your outpatient pharmacy, who we can get in contact with, so that we can get you the best treatment possible.
Sure.
Okay?
Go for it.
All right, you ready to begin?
Yes.
Excellent. So I would like to start by asking if you are on any current prescription-based medications?
I am, yes.
You are. Excellent. Would you mind telling me that first one?
Yes, so it's a medication called hydrochlorothiazide.
Okay. Do you happen to know the strength of that medication?
Yes, the strength is 50 milligrams.
You said 50?
50, yes.
50. Excellent. And do you know how you take this medication?
Yeah, so I'm taking it 1 tablet every morning for high blood pressure.
Okay.
But recently I've been taking just a half a tablet every morning because of the side effects, like I have to go to the bathroom all the time. So in sense of today, I only took about half a tablet today.
So you said you've been taking half a tablet every morning instead of the prescribed dose?
Yes.
Okay. And you said the reason that you're doing this is because you
I've been,
frequency in bathroom?
Yes, correct.
Urination?
yes.
Okay. All right. And do you know why your doctor prescribed this medication for you?
Yes, it's to treat my high blood pressure.
Okay. High blood pressure. And again, you are just supposed to be taking 1 tablet in the morning, but you've been taking half a tablet.
Right.
When was the last time you took a whole tablet? Do you remember?
I don't remember because I've been taking the half tablet, but I can tell you when I took my half tablet.
Can you tell me when you started taking that half tablet?
I can't give you a specific date whenever I started taking a half tablet, but I know I consistently take it at 8 o'clock in the morning.
Okay. And was that today or yesterday?
I took it this morning for today.
This morning, okay. Today's the 22nd, and you took it this morning. Okay. Thank you so much. Are there any other prescription-based medications that you're currently taking?
Yes, I am.
Okay. Would you mind telling me the name of that?
Yeah, it's a medication called Ramapro.
Excellent. And what strength?
It's a 10 milligram tablet as well.
10 milligram tab. Okay, and can you tell me the directions on how you've been taking this medication?
Actually, it seems like it's a capsule. I remember it's a capsule.
Oh, you remember it's a capsule?
Yeah, I keep getting that mixed up.
That's okay.
Hydrochlorothiazide, but, yeah, I usually take the capsule every day in the evening. I know I take it for my high blood pressure.
Excellent. And you're only taking one capsule a day?
Yes.
Okay, one capsule in the evening. Sorry, I'm a little slow on computers.
That's okay.
Do you happen to know the reason why your prescriber put you on this medication?
He put me on this medication to control my blood pressure.
Okay, another medication for high blood pressure?
Yes.
Excellent. Do you happen to remember the last time that you took this medication?
Yeah, I took this medication around 8 o'clock last night.
Okay.
That's what I remember.
Thank you. And have you been having any issues with this medication at all?
I am not.
No? You take it pretty consistently?
Yes, it's been consistent.
Excellent. Are there any other prescription-based medications that you're currently taking?
Yes, I'm taking another one called atorvastatin.
Okay. Do you happen to remember the strength?
I think it's 40 milligram tablet, pretty sure.
40 milligram tab?
Yes.
Excellent. And how are you taking this medication?
I'm taking it one tablet every morning, and the doctor put me there for high cholesterol.
Okay. Do you happen to remember the last time that you took this medication?
I took it today, actually, around 8 o'clock in the morning.
Okay. Very good. And have you had any issues with this medication at all?
I don't have any issues.
You've been taking it pretty consistently?
Yes.
Excellent. Are there any other prescription-based medications that you're currently taking?
Yes, so I'm actually taking one more.
Okay.
It's an inhaler.
Okay. Do you happen to remember the name of the inhaler?
Yeah, I think it's called Brio Ellipta.
Yeah, Briolipta. Do you happen to remember the strength of the Brio?
The strength, I remember it's like 100 milligrams for the fluticasone and the 25 micrograms for the Bilateral.
Okay. Excellent. And do you know how your doctor has you prescribed to take this medication?
Yes, he wants me to take one puff every day for my COPD.
And do you remember the last time that you took your Briolipta?
I took my inhaler this morning around 8:30.
Okay. And have you been having any issues with this medication at all?
I am not.
You haven't been taking it pretty consistently?
Yes, it's been.
Excellent. All right. And you said that was the last prescription-based medication that you've been taking?
Yes.
Excellent. How about any over-the-counter medications? Are you on any of those at the moment?
Yes, I am taking one.
Okay.
It's called coenzyme Q10.
Excellent. And do you happen to know the strength of that medication?
I don't remember the strength on the bottle for this one. I don't.
Okay. Do you remember how you take it?
Yeah, I usually take this medication every day in the evening.
Okay, so we're gonna do
Okay.
2 cases, I think. One is held by patient, one is held
I
by.
usually take this medication with my atorvastatin, so I think it's around last night, around 8 o'clock.
Alright, so last time you took it was last night at 8 p.m.
Yes.
Okay. And how many are you taking a day? Is it just one
Yeah, I'm just taking one tablet.
tablet? Okay. One tablet in the. Any reason why you started taking this medication?
Yeah, I got some bad leg cramps and pain whenever I take my cholesterol medication, so I usually take it to prevent the leg pain.
Okay. Excellent. Well, thank you so much for providing me with your current medication list. Is there anything else that you need to discuss with me?
I don't have any questions so far.
Okay. Actually, I see that you have some
Yes.
bottles over there. Would you mind if I took a look at that?
Yeah.
Excellent. Looks like you've got all of your prescription-based medications in this bag. Thank you. If you don't mind, I'm just going to take a look at these and just verify.
No problem.
I'm gonna mostly be looking at your spreadsheet just to link you back up with what's in each cell, but if something was different, then maybe I'll have something then I'll put it in here. So it's set differently. So it's only
I love this Brio Ellipta in the bottle.
I know I just take the puff right out the bottle. This keeps the air in there. Yeah.
All right, excellent. Thank you so much for showing these to me. Why don't we go ahead and put them back in the little bag here. Thank you. The next thing I'd like to talk about is any medications that you may have been on in the past that you have currently stopped taking.
Yes,
Oh, you've got one?
I have one
Okay.
that I remember. It's called simvastatin.
Simvastatin. Okay, do you happen to remember the strength?
It's a 20 milligram.
20 milligram. Was it a tablet?
Yes, it's a tablet.
Do you remember how your doctor had you taking this medication?
I don't remember the specific details. I only remember that he switched me to a different cholesterol medication
Right.
in replacement of this.
Right, so he had you on this medication for high cholesterol,
Yes, correct.
and he switched you to atorvastatin.
Yes.
Do you happen to remember the last time that you took the simvastatin?
So my doctor switched my medication around 5 months ago.
Okay.
So what I remember was around 5 months ago.
Okay. All right. Anything you want to say about the simvastatin? I know that you've switched and you haven't taken it in a long time. Yep.
Yeah, the simvastatin actually gives me like cramps. That's one of the reasons why I stopped taking it. Because I didn't really like being on that very much. So I'm gonna try out that atorvastatin.
Excellent. Thank you so much. And that was the only medication that you've currently stopped that you can remember?
Yes, correct.
Okay. All right, next up I'd like to discuss allergies with you. Are there any medications that you're currently allergic to?
I always known to be allergic to sulfa drugs, accordingly to the doctor. I never had a reaction to it, but the doctor says that I'm allergic to it. So I'm not too sure.
Hello, I'm Audrey.
Okay.
Hoffman. I'm your student pharmacist.
So your doctor gave you an
Today we're gonna
assessment,
be
sulfa
on your
drugs might be
medication
problematic
history.
for you?
Yes.
Even though you've never exhibited a reaction before?
Yeah.
Sure, my name is Sarah
Okay.
Johnson and I'm a 65
Thank you so much for providing that information for me. Anything else, maybe not drug related, bees, cats, dogs, any other allergies you might have?
No, I like to stay inside a lot and I got no pets, so.
Okay.
Yeah, I don't have any allergies to any of that.
Excellent. All right, and finally, the last thing I'd like to discuss with you is just your outpatient pharmacy, where you normally pick up your prescriptions. Do you happen to know where that is?
Pick, most of my medications from HPU pharmacy.
Okay. Do you happen to have a phone number for that location?
I don't, but I always remember calling it, by looking up the phone number on my prescription bottle. I can take one out for you and you can take a look at that phone number.
Yeah, that'd be great. There it is, plain as day.
Inhaler, but I don't think I brought it in the bag.
Okay, that's no problem.
Excellent, thank you so much for providing that information for me.
Okay, so first.
And we are done with our medication history assessment. Did you have any questions for me before we dismiss?
I don't have any questions.
All right. Well, thank you so much for being a super patient, Sarah. I certainly did appreciate talking with you today.
Thank you.
And if you have any further questions that you think of later, you can always get back in touch with me at this facility, okay?
Okay, sounds good.
All right. Thank you.